What's up, everybody? Alex here, and you're listening to the Jiu-Jitsu Radio Podcast. As always, this podcast is sponsored by ChokeAloha.com. Head over to ChokeAloha and pick yourself up some new gear, because if you use the promo code Jiu-Jitsu Radio at the checkout, you will get 10% off your entire order. And if you head over there in the next couple of days, I know they're releasing some brand new apparel that looked pretty sweet from the sneak peek that I got. I'm definitely picking up one. And you get to save 10% on the order. You can't beat that. Choke Aloha has been an awesome sponsor of this podcast since day one. I don't make any money off of them, but they are supportive of me, so I want to be supportive of them. And I want you guys to go support them too and go check them out, chokealoha.com. As always, you can check out all my photos and prints and apparel that I make with my photographs at mycosmicjourney.com. You can check out all the latest photos that I take. I'm debating if I can get enough support from everyone. I'm going to be selling a limited edition print, and all the proceeds will go to the victims of the Harvey hurricane that happened in Texas this past week. Sending out all thoughts and positive vibes to everyone that's been affected by the hurricane. So I'll keep you guys posted on that. If I can get the right support on it, I'll get that up and running. Just check it out at mycosmicjourney.com to keep up to date on everything that's going on with me. I've been running around taking photos and taking videos and recording another podcast. This episode is actually pretty cool. I've been wanting to do this one for a few weeks now. I had to drive up about an hour north of here once again, actually right down the street from the Armory where it was last time, and I stopped by the office of Novagenix. Novagenix is a hormone replacement and anti-aging clinic. There I met up with some really cool people, Dr. Sigman and Blackbelts Tim Bruce and Andy Stock, and they own and run Novagenix. And the biggest thing out of this whole podcast, my goal was to get as much information as I possibly could, because I do find that there is a limited amount of in-depth information when it comes to PRP. PRP is something that's been kind of like the buzz when it comes into recovery for sports in the last couple of years, but it's actually been around for quite some time. And I really felt that there needed to be a more in-depth look at the science behind it. So what better way to get that information than to go straight to the doctor, straight to the source, and really get an idea of what PRP has to offer to people. Some people just automatically think it's the same as the testosterone replacement treatment. It is not. It is something completely different, but the healing properties of the PRP, from everything that I've seen and that I've heard, is quite incredible, and I needed to get more information. This podcast was not some kind of elaborate advertising for Novagenix. I do support Novagenix, and I think they're doing a great thing there. I have actually never even gone in there for treatment. Maybe I'll change that if I can afford to do it soon. But this was nothing more than me trying to get some information and educate myself, and hopefully educate you all on the treatments that are available to people that are not just readily accessible information-wise, because as we all know, Big Pharma, I'm not a conspiracy theorist, but Big Pharma and a lot of doctors and medics, all they care about is making money. And they don't really care about making people better or having people heal up and be good. No, they want to have people constantly come back and need a reissue on their medication. They need to get all new painkillers and stuff like that. And obviously with the car accident that I had a couple of months ago, I wanted to get more information about that. I'm not a big fan of medication and painkillers and surgeries. I do feel that there are things out there that we can do. I'm not talking about all kinds of magical, mystical, homeopathic stuff, but there are some things that really do work, and there is the technology out there that shows that we can get better results in a less invasive way to the human body, and there are ways that we can use our bodies to help itself heal up, and PRP is definitely the way that I feel is going to be amazing in the future as it develops even further. Anyway, enough with my talking. I want to get straight into the podcast. If you feel like looking more into the information in regards to PRP and what Novagenix has to offer, whether you're locally in the area or just you want to read up on what it is that they do, and maybe there's an office that offers the similar services near you, check out novagenix.org. That's Novagenix.org. Contact them. But in the meantime, here is Dr. Sigman, Blackbelts, Tim Bruce, and Andy Stock from Novagenix. Ladies and gentlemen, welcome to Jiu-Jitsu Radio. My name's Alexis Trosa. I am your host, and today I am in Jupiter, Florida, at the home of Novagenix, and I'm here with Tim Bruce, Andy Stock, and Dr. Sigman. Gentlemen, thank you very much for joining us. I actually have two black belts next to me, and then the black belt in science here. Doc, how you guys doing? Thank you very much for doing this. I appreciate you taking the time.
No,
sure.
Thank you for
Thanks for having us.
Yeah, thank you.
So if you guys hear any kind of random noises and stuff like that, we're in an actual office. These guys are actually working, and I'm taking up their workday. So, gentlemen, thank you very much for doing this. You good there? You're comfortable? All right. I just want to make sure the doc's comfortable.
Yes. Great, thanks.
So, yeah, again, thank you very much for doing this. So Tim and Andy are actual black belts. And you actually have some big news for a student tomorrow, but I can't throw it out on here, right?
Yeah, well, this isn't going to be broadcast today, is it?
No.
Okay,
so you're good.
Yeah, so no, we're going to be promoting one of our guys to black belt tomorrow. It's a surprise, but since this isn't going to be broadcast today, we can get away with it. So
yeah, good, man.
Nice.
Cool. Congratulations. He's the first one you said that went from white.
Yeah, he's going to be the first student that came in day one, white belt, no jiu-jitsu, and now we're giving him his black belt. It's,
How long did it take him?
He's done it quick, at about 8 years, which is pretty fast. But the guy's been doing it religiously, running a school 6 days a week. Just competing, putting together tournaments, promoting MMA events. The guy's done everything that you can ask for in jiu-jitsu. He's phenomenal, and anyone that's ever trained with him and knows with him and rolls with him, he's philosophical, he's unorthodox, and he's got incredible pressure technique, and he's just a true ambassador of what jiu-jitsu should be. So I'm pretty excited, and we're gonna have a nice group, a bunch of black belts there to help with the ceremony, and his family's
So how long
coming.
would it take me? 8 years is quick. What about an old doctor? How long could I go from white to black?
Well, knowing you, might take a little longer than 8 years, but it's not really about how long it takes you to get to black belt.
No, I just had no idea. 8 years sounded like a long time. Good Lord,
no,
that's pretty fast.
That's actually really
fast. I know
fast.
you guys put in serious amount of time.
Yeah, most people, it takes probably an average 10 to 12 years for most of the guys I know, but it depends when you get started, how serious you are, how motivated you are, and if you're training every single day, it's going to happen a lot faster than someone that's only, coming as a hobbyist a few times a week, and, if you start when you're, younger, it's going to happen a lot quicker than if you're, your age.
Yeah, there's guys, right, that take 15, 20 years to even do it. It just comes down to the time to put in. I'm on the 20-year route right now.
It's a marathon.
Fast track.
Yeah.
No, it's not a sprint, it's a marathon. And they say once you get to black belt, I didn't understand it until it happened, but once you get your black belt, that's when you can really start to learn, because it's like getting to that point, now you have the knowledge, now you can read and write jiu-jitsu, so to speak, and now you can actually start to learn. It's a lifelong endeavor and process. It doesn't happen quickly, and it never stops. So But it's really going to be a cool honor, and he deserves it. And hopefully he doesn't know, but he's probably going to be like a little taken aback when all like his family shows up.
Yeah.
So they're trying to trick him. They're like, yeah, we're just going to come celebrate your birthday early.
Right.
But then past students that haven't been there in a couple of years are going to
Show
show
up,
up.
yeah.
Other
Like
black belts. So.
that's when you start questioning, like, wait, what's going on? Like, and it's not an intervention. We're actually
Yeah.
Well, he's sharp, so he'll know.
So to really interlude into why I'm here, you guys are at a very unique position because you have trained, you've been doing this for so long, and you also run Novagenix. Can you give me really the synopsis of what Novagenix is?
Sure, I can handle it. So it basically, I'd say about a year ago, my partner Andy, he's a first-degree black belt in Jiu-Jitsu. And Andy's been, Andy and I, Andy, how long have we known each other?
7 years probably, at least almost 8 years probably.
It's been a while, and I remember like on a jiu-jitsu forum, he reached out to me like, hey, where's a good place to train? I was training down in Delray at RMBJJ with Professor Rodrigo Mendez, third-degree black belt, great guy. Incredible academy. If you guys are in Delray, you're looking for a place to train, definitely go check him out.
He's actually the first jiu-jitsu school I ever walked into. I got my first free class at Rodriguez.
There you go.
Awesome. That's cool.
Yeah. So
he needs to grow that beard back.
Oh, I don't know, man. But no, he's a good guy, and they've got a really good program, and so I told Andy you should come and train down there, and he came in and. I don't know where you were living at the time, but
I was in Boca. I just moved to Boca.
So so it made sense for him, and that's how I met Andy. So about a year ago, he was working, running 2 of these these clinics, and he was like, listen, I'm sick of doing all this work. I want to open up my own place. So he was looking for a partner investor, and he kind of told me what he was doing, and I was like, this is in my wheelhouse. I love it. Let's do it. And ironically, the gentleman who's getting his black belt tomorrow, his uncle happened to be really good friends with Dr. Sigman, and he's like, I know you guys are looking for a doctor. This guy's actually really experienced and knows his stuff. And so, we met the guy one night at Duffy's, and turns out, he's an absolute encyclopedia when it comes to all the different things that we do. And it turns out that it's a perfect mix for jiu-jitsu because we're dealing with, obviously a lot of injuries, so the platelet-rich plasma therapy for jiu-jitsu makes perfect sense. And then as guys start getting older, when you start getting your late 30s, 40s, 50s, and you want to continue doing jiu-jitsu, it's kind of hard to have the energy, the motivation, the same muscle structure. So having the testosterone replacement therapy, hormone replacement therapy to help out is it's phenomenal. It keeps these guys, if you're a 50-year-old guy and you want to compete with these 22-year-olds that are coming up, you need a little bit of an edge because your body's slowing down. But that's why, fortunately, modern medicine and preventive medicine can really help give you the leg up to keep on doing what you love, because it's hard otherwise.
For sure. I don't consider myself old, but I'm definitely not young anymore. I just turned 34, and it's like, what? I might need to double check on the stuff that I need. So now, focusing onto you, Doc. Kind of just give me an idea so people understand really your background and your knowledge and why you have the credentials to speak about all this.
Well, I'm a native Floridian. I was born and raised in West Palm. I wanted to be a doctor since 4th grade, and it was my dream. My granddad is a doc, my uncle is a doc, and funny enough, my pediatrician in Jupiter, who's gone now, but Edgar Stevens, best bedside manner of any doctor I've ever been with, and I, just loved science and medicine, and so, that was my dream from early childhood, and started practicing medicine. Got board certified in internal medicine in 2001. And started a private practice in Sebastian, Florida, Vero Beach area, and basically just boomed. I did really well. I'm very honest with people. If I don't know the answers, I'll tell you I don't know, but I'll find out. I'm also OCD, so I like to make sure everything is the way it should be and end the day with everything cleared off my plate. And if I don't have answers for people, I just have to keep looking. I love research and reading, and I've kind of been addicted to reading since 2004, when I just had gotten to the point. I was about 3 years into private practice and probably about 3,000 patients, and these are really sick folks: diabetes, heart failure, cholesterol problems, blood pressure problems, strokes, Parkinson's, sports injuries. I mean, you name it. It was a big practice, and I was kind of getting disillusioned and tired of disease drug, and wanted people off of medicines and pills and things unless they absolutely had to be on it. So I started doing a lot of reading and research and going to conferences, preventive medicine lectures, conferences, anti-aging conferences, sports medicine conferences, and really started to turn the practice into a wellness, anti-aging type practice. Although I still did traditional internal medicine, I think outside the box. Unfortunately, in medical school, we weren't trained, to do a lot of this stuff. You just have to keep learning, and I learn every day. I learn new stuff today. So, you just try to apply that to help people the best you can. So getting into prevention started with hormone replacement. The studies and science behind testosterone therapy are amazing. It's not just for your sex life by any stretch. I was looking at it more for heart disease prevention, diabetes, better blood sugar control, obesity, physique, osteoporosis, dementia, you name it. And the studies are very clear, and there is conflicting reports here and there, but when you really dissect the articles, the scientific studies that often show negative outcomes are really not very well designed or done studies. So but I read the negative and the positive, so I'm on top of everything as best I can be. And it worked. Getting people's hormone levels back to normal with bioidentical hormones, getting vitamin levels optimal for just maintenance and general health. I was able to get more people off of meds, pills, get their physiques in shape. They're in better shape, and it is really amazing. So that really started me in about 2004. And since then, I've just expanded, and I try to learn something new every day and apply it.
Yeah, that's pretty big down here too, right? Talking about like preventative medicine instead of we have such a huge problem down here with people just painkillers and stuff.
Yeah.
Right.
It's not prevention. It's just numb it. It's right. And you're not fixing people. If anything, you're causing more problems.
Right. And PRP. There's very few things that, after almost 20 years practicing, you go through burnout phase and you go through, man, I'm tired and this and that. But, the few things I can, name them on one hand that got me excited. And one was hormone replacement therapy. That was the first. The second was HCG and weight loss. And, I set up a weight loss program that we're using with Novagenix. The guys have helped me improve it and work on it and get things kind of fine-tuned, and probably had 1,000 people go through it, 6-week program, and man, that was amazing with weight loss and getting people in shape. And then the big thing now that I've been really just thrilled about is PRP, platelet-rich plasma, which oh my gosh, I probably have done, I'm well over 500 procedures, I would say, in the last couple of years, 2.5 years, and everybody improves, everybody gets better. I can't guarantee you how much, but you're going to improve 30, 50, 80% just with, one round of injections. I love it because it's your God-given stuff that we were made with. We're not adding anything. We're just using your stuff to heal you and speed up the process.
So it's like you're literally biohacking. You're just hacking
yeah.
So, you and I talked about this a little bit before. For people that, that name gets thrown around a lot, PRP, give people a real explanation as to what it is that you are doing.
Okay. It really is pretty basic. The bone marrow, we have 3 cell lines or major cell lines: red blood cells, which we all know carry oxygen, white blood cells fight infection, And platelets, most of us know that, they clot, they stop the bleeding, things like that. And I mean, that's kind of what the general idea. But platelets also are basically the recruiters of every healing process in the body. So your platelets will, if you have an injury, let's say a rotator cuff tear or, a meniscal tear in your knee, the numbers are arbitrary, but we'll just say, hey, your body sends 100,000 platelets to that area. And your platelets then decide what's damaged, what needs to be
All right, you're fine. No worries.
taken care of. Sorry.
It's a working office.
Right. So, your platelets then put out growth factors and recruiting factors that tell your stem cells to divide and turn into whatever's been damaged. So with PRP, all we're doing, remember I said, again, the numbers I'm just,
Arbitrary,
making it
right.
right. But so if your body sends 100,000, what I'm doing is I'm drawing your blood, I'm spinning it in a centrifuge machine at an optimal speed for
Careful.
getting platelets concentrated without damaging the platelets.
Right.
And then basically injecting 1 million into your rotator cuff injury or your knee or whatever. So we have a tremendous amplification. I mean, we're really blowing up the healing process, but it's letting your body do what it thinks it needs best.
Just giving it a boost, like a concentrated boost of it.
Absolutely. It's concentrated. The healing time is significantly better.
What is the healing time? Like, what is the recovery time for something like that?
Well, usually, so what the process is, you come in, we draw your blood. Usually it's 2 to 6 tubes of blood that we draw. The spin, the centrifuge takes 30 to 45 minutes, and that varies a little bit. If I'm doing cosmetics and I'm doing facial stuff, I will spin it a little longer. There's certain, criteria we look at and follow. But you basically spend it 30 minutes, and then when you pull the tube out of the centrifuge, it's divided into 3 layers. You have a red blood cell layer, you have white blood cells, and then a little platelet plug. And then on top of the tube, you have your plasma and platelets, platelet-rich plasma. So what you're doing is you're just drawing off the top of the blood tube, and that's got all your platelets highly concentrated, all your growth factors for healing, as well as your own stem cells. And your stem cells, that's, your platelets are orchestrating and directing your stem cells to turn into whatever's damaged. So like we forget, if you get a big cut on your arm, like a big, gash on your arm,
Right.
and you need stitches really, but you can't do it. It takes 4-6 weeks to heal before it's completely scabbed over and everything else.
Right.
Well, what we've done, if we think about it, and I mean, our bodies are amazing, right? You've cut through epidermis, dermis, subcutaneous tissue, connective tissue, fat layers. You've cut through arteries and veins. You've cut through capillaries. You've cut through muscle potentially, definitely damaged nerves. So we have 10 different types of tissue right there just in a big gash on your arm. Again, so your body sends, let's say, 100,000. Well, I'm concentrating your platelets and growth factors and healing factors and putting in 1 million in that area. So instead of 6 weeks of healing, you might see significant results within 2 weeks. So it's a tremendous boost. I mean, the numbers, again, everything is variable based on the patient's health and their age and certain things like that, but everyone improves, and it's exciting. I mean, to see every single person get better, there aren't many things in medicine where that make you smile and make you feel good about, hey, I'm really doing a good
Right.
thing for folks here,
But there's not even like a reaction that your body would do that it can't handle, right? Because it's like you're just using your own body to help your
Correct.
body. So it's not like your body all of a sudden's like, hey, there's too much platelets here, like hang back a little bit.
Right. No, and it's called an autologous, basically it's like a transplant. I
Right.
mean, So, but it's your own cells. Like, I can't use...
You can't OD on your own cells.
No, right.
Yeah.
I can't hurt you with it. The only thing I can do, and I kind of push the envelope a little bit. The way I operate is I try to do as much as I can with each, injection. And a lot of that's just, there is the art of medicine there, but the trade-off is I might inflame you a little more. You might be mad at me in the afternoon because your shoulder is a little more inflamed and sore, but you're going to thank me later because maybe you don't have to come back in for round 2 or round 3.
Right.
So a lot of folks, depending on the injury, how long it's been, the type of injury, I mean, they might only need one injection to improve significantly.
Right. So you do a lot of work with the MMA fighters, and because they have to walk, obviously I'm not going to name any names because it's not my
Correct.
job to
Sure.
name anybody. You get to walk on a line that most of these guys have to worry about, which is like dealing with places like USADA and stuff like that. So you don't have to worry about, you're not doing anything that doesn't follow the guidelines. You're using your own body, and you're not really tweaking anything. You're not trying to pull a John Jones and circumventing the stuff.
I've actually reached out, to USADA because one of the things that I have to deal with is making sure that his job is practicing medicine, but it's a little different when you have to worry about these fighters that have such strict guidelines. And we've printed out everything, the banned substance list on USADA. It's like 9 pages long. Yeah. And I've actually contacted USADA and asked specifically about PRP, and it's good to go as long as, and of course they like to give you stipulations so that they can always have some ultimate control at the end. But what they said was, as long as you're using it for like an injury recovery, which is what we do it for, to get you back to pre-injury form, but you're not allowed to use it to enhance what so you can't be like, hey, I'm fine, I don't have any injuries now, I'm going to do a little PRP and get you. So they just want to make sure that you're using it the right way to recover, and that these guys aren't trying to give themselves a competitive advantage. And that's what we do. So we're good to go there, which is
that's
great.
amazing.
When I look at performance enhancement, I've treated athletes for years, professional and non-professional. I mean, I've had a lot of folks I've treated, and I answer to the big guy upstairs, so I'm going to do everything as honest and ethical as I can, and I don't want to give anybody an advantage or an edge, and that's not what my job is. PRP does not performance enhance, absolutely not. We're basically helping the body recover and heal quicker, than a normal response. The PRP, it just, there is no concern or worry on my part. You can do it for cosmetics as well. Is that performance enhancement? Well, no, you're getting rid of wrinkles and stuff like that. But no, I mean, there is...
That's a confidence enhancement more than anything.
Right. So no, the PRP does not performance enhance. You can do it in the Olympics. You can do it in the NBA. You can do it in the NFL. It is completely acceptable therapy. And again, there's no fear or concerns there. And I have all the guidelines, like Tim has said. I have Olympic guidelines, I have NBA guidelines, Major League Baseball. I mean, we have the information because I want to make sure I'm doing everything, that's upstanding. Yeah. And that's the way we operate at Novagenix. We try to do the right thing.
But you're also doing something that helps people, but it's you're keeping it in the balance that they can live like this, and it's not like
their
they have
careers,
to
and this is their let's be honest. Are we performance enhancing when I lower your blood pressure or lower your blood sugar or help you lose weight? Well, yes. I mean, medicine should be performance enhancement. We are trying to do wellness and preventive medicine, but this is not in the realm of anabolic steroids where you're using testosterone to gain muscle mass or strength, or growth hormone, which honestly does not performance enhance, but they treat it like it's a performance enhancer. It's an anti-ager, but growth hormone is, not an issue that way either, but that's the law, so I would not use that in any fighters or anything.
The reason why I really wanted to talk to you, and you kind of said it earlier, like when it was just us talking, and also in the podcast, is that you got tired of the disease, like Medicaid stuff.
Disease drug.
You wanted to actually work with people on helping them get better.
Absolutely.
So that's why, what I said before, it's like a very unique situation because, again, I come from a jiu-jitsu, in world, and also, I've played sports my whole life. I've got injuries up to wazoo. That's fine. But, Tim, from experience from being a black belt, to be a jiu-jitsu black belt, your body's going to take a beating. And it's not something that is just I'm going to walk it off, or it's going to be a week or two. It's no, this one stays with you for life.
Oh, there was a job I was working, they said we can, some of the guys were joking with me, we can always tell when you're walking, when you're coming, because we can hear you walking down the hall.
Yeah.
My body just cracks and creaks, I've had, between ankle locks, heel hooks, Kimuras Americanas, neck crank, every part of my body I can, just
you can hear it from here.
It's amazing. And if you compete, it's worse. As you get older, you have to train smarter because you just can't subject yourself to those injuries. I've got a life, and I remember I was telling you before, I used to ref for the IBJJF. I was one of, it was Hillary Williams, Stephen Hall, and myself were the only 3 American refs at the time, and it was brutal. And I remember going through, we were out in California before Worlds, and Alvaro Mansour was doing the referee training at that point, and someone asked him what's up with the leg locks? Why can't we do leg locks? At that point, besides a straight ankle lock, why can't you do any of the leg locks? And he was very, forthcoming, and he explained it, and it made sense to me. And as you get older, you understand and appreciate it. He said, if you break your arm, and he did it in his very thick Portuguese accent, you can still walk up these stairs and go home and go to work the next day. But if you break your leg, you can't get around. So, ultimately they want to protect the fighters. And I know it's, it can be frustrating.
Closer. Sorry.
I know it's frustrating when you see some of the other tournaments the ADCC and some of these where they can do heel hooks, knee bars, and everything. But at the end of the day, if you're not an experienced jiu-jitsu competitor and you twist and you roll the wrong way, well, now you just tore your ACL.
Well, it happened. I want to say it was last year. I don't know, Doc, how familiar you are with EBI, the Eddie Bravo Invitational, where everything goes there. You can do leg locks, you can do whatever. That's fine.
Right.
And I'm, again, relatively to you, I'm a beginner. I am completely you should be allowed to do stuff, but it's also there are limitations. Some guys, the guys are just stupid. They're just going to crank it, or other guys just hold it. So they had the first, teenagers to do it, and it was 2 girls, 14, 15, 15, 16, and they agreed on the terms, everything's legal. So the one girl was really well versed in leg locks, grabs the other girl on the heel hook. She had it, and the girl wasn't tapping. And all of a sudden, you see the leg just go from here and just pop a 90 degree. It just destroyed her knee. She didn't even know.
It happens very quickly, these injuries.
Yeah.
And anyone who's ever had a ligament get torn or pulled, you feel it's strong, and then it's like a Charleston chew bar. All of a sudden, it reaches that tensile breaking streak, and you just feel it just stretch out like taffy. It's terrible. And to have leg attacks at that age is really dangerous because, A, they don't really know what they're agreeing to.
Yeah.
And now if it's a bad enough injury, she's, A, going to be out for a while, and they might never be the same. And for a 14 or 15-year-old to now have that issue going on physically where they can't compete or fight, it's not fair for the rest of their life. It's going to interfere. What if she had a physical job where she wanted to be a cop, a firefighter, or something like that, and now she's always going to have that injury that's going to hinder her.
God forbid, you never know when it's going to come back. You might be if she is a firefighter, she's carrying someone out the building.
Now I will tell you too, the one beauty of PRP, since we're using your own body's makeup, age really isn't much of a factor. Pre-growth plate, fusion, I don't treat kids, but somebody that's 15, 16, 17, PRP you can use on anyone. The only thing, if I add anything to the mix, it's lidocaine, which is a local anesthetic, and sometimes I don't even do that depending on it. But it is truly your own body healing, telling you what needs to be fixed. And you don't need MRIs, you don't need x-rays. If you don't necessarily have to know exactly clinically, you usually can tell what the injury is, and you're going to improve with PRP either way. It's just how much, and of course, there's red flags of back pain and red flags of certain things that you would want to make sure, before you do injections. But the beauty of it is, I could tell you from a lot of experience with shoulder injuries, and I don't want to have shoulder surgery unless it's the last option. I really don't want to have neck surgery or back surgery unless it's the last option. And this gives people, patients, a chance to actually let their bodies heal themselves without significant intervention other than just some injections. So it's incredible. I mean, it excites me. It just still makes me laugh.
So let me ask you, as far as what it can be applied to, because obviously it's got to have some limitations. Like it's exciting to hear like how much you can do, but it's got to have some limitations because not everything is a miracle.
Oh yeah,
correct.
It's about like this is as close as you're gonna get. But what is it? Is it really for any kind of injury? Is it, let's say, like, is it just muscular? Is it tendons? Is it ligaments?
No. So so if you look at, you just kind of break it down to what, the common sense elements of, well, what is it? How is it working? Why is it working? Right. So you say, all right, we've concentrated your platelets and plasma, which has stem cells, and your stem cells. I'm 46 years old. Mine are 46 years old. They're not as vibrant as somebody who's 26 years old, but mine still can turn and divide into any damaged tissue. And that's what I'm saying. We kind of forget. So my stem cells can turn into skin, hair, bone, muscle, tendon, ligament, kidney, liver, heart. I mean, you name it. Your stem cells will divide. They're pluripotent. They can turn into any cell, and the platelets direct that. So the platelets look at the damaged areas. They send out growth factors that will say, we need more blood vessels laid down. We need more nerves here. We need more skin, things like that. So, it's your body directing the show. As far as drawbacks, I mean, gosh, the drawback is, we are actually causing inflammation. I guess if there's a drawback, I'd say, well, it's because, we're going to inflame you a little bit. So you're coming in with shoulder pain or a shoulder problem or a knee problem or a back problem. You're going to go home, and after the lidocaine, if we use it, wears off after a few hours, you're going to be a little sore and irritated that area. But by morning, or, you're usually good to go. And so, and then your cells, those stem cells, are healing and dividing up to 3 months usually. Mm-hmm. Typically at 6 weeks, we'll know. So what I'll say is, if you have to do a knee injection or whatever the injury is, we'll know about at 6 weeks where you are. And you'll come in and say, I'm 50% better, 30, 80, 100. And then you can redo it. I mean, there's no limit to how many injections of PRP you can get in any joint or any body. It's different than steroids. Steroids work as far as reducing inflammation and irritation, but they don't heal. Mm-hmm. They really do serve a purpose in the rightful spot, but you can only do 3 a year in a major joint. Again, it's calming your symptoms, it's helping you be more comfortable, but it's not really healing. Whereas PRP actually kind of inflames you a little bit initially, especially if I am pushing the envelope a little bit and try to do as much as I can. I'm going to actually make you a little more inflamed that afternoon or evening, but by next few days, you're good.
Yeah, and I do a lot of the patient follow-up, so I know everyone, it's always a little bit different, but I mean, we've had a lot of UFC fighters. I don't always give their names because they didn't give permission to say it. I'm sure they wouldn't have a problem, but they all respond a little differently, but what he was saying is true. Usually like day one, that night, they're like, it's a little sore from the injections, and the next day they're like, it feels a little tight, like stiff, because like it's swollen. And that's exactly what we're trying to do. We want to induce that inflammation to really start to deliver the nutrients so that the PRP and all the growth factors and the cytokine can start to regenerate and repair that damaged tissue. And usually usually within a week or two, they start to notice a tremendous difference. I had a Jiu-Jitsu blue belt who's a firefighter. I mean, he had some herniated discs in his neck, and it was starting to really affect his life. He wasn't training Jiu-Jitsu. That wasn't even an issue. He was having problems at work doing very basic functions, and being a firefighter is very physically strenuous. And we asked him on a scale of 1 to 10, and this was only after about a week and a half, what was the improvement? And he said on a scale of 1 to 10, it was a 9. He said the only time if he was doing real heavy lifting, it might be a little sore, but he said it was a miracle. It just changed his life. So I mean, there's those success stories like that. You're like, wow, this is incredible.
Yeah. But just to clarify too, this isn't just something that it's like you only recommend for athletes. Like this is someone like you. Like
no, I've done more 70, 80-year-olds with chronic medical conditions too. I mean, and again, you say, well, chronicity, if you've had low back pain for 20 years, how much are you going to improve in one round? And I can't tell anybody that. I just say, hey, you're going to improve, man, but I don't know how much.
See, like you said, like I got into a car accident like a month and a half ago.
Sure.
It's like I'm fine after jiu-jitsu practice. That's fine. My lower back is killing me.
Oh, yeah, I would tell you to come in and do PRP all day. Now, here's the difference with spine.
Yeah.
So with cervical spine, thoracic, or lumbar, I'm not going in the joint space there.
Yeah.
So in, shoulders, it's in the joint space. Knees, joint space. Hips, joint space. Sacroiliac joint, blah, blah, blah. But the spine, I'm not going in between the vertebrae into where the discs are and the cord. Because you have to do that under intervention and all that with radiological intervention and diagnostics there. You don't need to. All the nerves that come out of the spinal column, called the dorsal root nerves, which supply everything, they are all just coming outside the vertebrae. So I'm doing isolated regions or areas where basically, it's kind of like doing quarter-size injections, and I do overlapping concentric circles. I mean, you're thinking about how their injury, what it was, how did it happen, how long has it been. You're looking at some other things to kind of fine-tune the way I actually inject or my, technique. And again, spin rate and speed are a factor. There's some very good literature. And I think, the more we practice, the more I've done this over the last few years too. You start learning and improving as best you can to get the most out of each session. Yeah, right. Exactly.
So what about cartilage?
I mean, stem cells can turn into any cell in the body. So if we got enough stem cells and our platelets are telling our stem cells to turn into damaged cartilage, it should work. Absolutely. Right. So really any tissue. I mean, I've done cosmetically, we've done a ton of bald heads. I mean, it's actually miraculous. You can do facials, like instead of Botox, you can use PRP. And it's completely different. But again, PRP is actually trying to heal and lay down, more collagen, elastin, more connective tissue layer or fatty layer, more supple skin. I mean, so it's trying to do the same stuff.
So is it really let's say if it was like torn cartilage, would it just heal the cartilage, or does it actually have can it regenerate cartilage?
No, you're growing, right? Remember, it's hard to visualize a big cut on your arm, but we have to think about it, right? So you get a big cut on your arm. I mean, you got to think about, well, what happened here? Well, I cut through hair follicles first, then I cut through the epidermis, then I cut through the dermis, then I cut through the connective tissue layer, then I cut through adipose, then I cut nerves, then I cut arteries, muscle potentially. So all those tissues have been damaged. You put PRP in there, every one of your body does it without PRP. We're just totally amplifying the response and how the concentration of what we're putting in there. So we're highly concentrating your own stem cells, which can turn into any damaged tissue, and your platelets, which are direct in the show.
Yeah, I mean, that just blows my mind. Like, that's, again, one of the many reasons why, I wanted to talk to you is because you're literally reconnecting two muscles, or you're just putting everything together, and you're not experiencing any almost loss of reaction time.
Right.
But the engagement of the muscle.
You know what? Right. So the protocol, that's a good thought. Really what we have to do the only thing I ask of people before and after the procedure, right? So it's your downtime, this and that. So what the science kind of looks at, and again, there's different opinions, but this is kind of the basic research from what's out there. But we don't want people on any anti-inflammatories like Advil, Aleve, ibuprofen, prednisone, anything like that, at least 3, 4, 5 days before we have to do it, which sometimes is aggravating because people are in pain. Yeah. Tylenol's fine because it's not an anti-inflammatory. Remember, we actually are causing inflammation to heal. So we don't want people on those things. Then after the procedure, same thing. With no anti-inflammatories. We don't want you to use ice after PRP. Ice is great therapy, but not with PRP. Because that's going to reduce inflammation. Yeah. So we say Tylenol post-procedure, and warm compresses are fine. And then try to give us 72 hours. Now, this is tough for a lot of the fighters and athletes because they're on very
limited
strict,
time frames,
regimented workouts, right? And also have competing here. So that's where the art comes in too. But if people can just lay off that main injured area for, we try to say 72 hours, 48 to 72 hours, but if you can give me 3 days of minimal activity on whatever's damaged, you're just going to, you'll just heal a little faster, but you're not going to hurt yourself by going out and working out the next day. Yeah. I'm just going to tell you, well, don't blame me if
just don't go for personal records,
right. Just say, hey man, if you don't heal as much as I thought you should, it's probably because you overdid it too soon. But the reality is you can't hurt yourself doing it. You just might have to come back for a second round or third round. But again, you can do it. It's unlimited.
And the one of the issues that we find with a lot of the pro fighters is you tell them you need to take 72 hours off. They look at you like,
I'm a
like
freak.
You've got 3
so,
heads.
No, doc.
So I can go back to train tomorrow, right?
Yeah. Well,
no. This is a great example. There's a guy that says, "Dude, I'm just going to do a light workout." I won't mention his name, but I'm like, all right. And I love these guys. I mean, what y'all do blows me away too. It's exciting. It's like, oh my gosh. I mean, true athletes. This guy's like, yeah, well, I'm not going to work out, but okay, good. I mean, I made myself clear. Hey, man, give me 72 hours. Really try. You can do legs because I think we did it. Or no, we did his knees, I think, or something.
Yeah, we
but
did
I'm like, you could do
knee and a shoulder.
Right, you could do this, or this, but just don't work out that area, whatever. It's like, all right, that's cool. So then I get a call the next day, and Tim or Andy were like, hey, Mr. Smith said, hey, I'm just going to do this. His light workout was a 100-mile bike ride. Yeah. And I'm like, what? No, man. No, dude.
It doesn't work that way.
Right, you can't do that. You're going to, but he wouldn't have hurt himself. He just might not have gotten what I wanted for him, which is, man, I want you to heal. If you could give me a couple, 2-3 days of just letting your body relax, guilt-free, because everybody feels guilty when they don't work out. Yeah. I don't want you to feel guilty. No, you're going to be better in the ring. You're going to be better in the tournament. You're going to be better in practicing before that if you can give us a little bit of time. But you know what I mean? It's hard because it's your livelihood.
Well, we know it's always coming from like you know that you could take a day off or 2 days off, but as a competitor, you're like, no, every second that I have to sit on the mat is going to benefit.
And I always stress it's like really easy. You're tired. You're like, oh man, I'm sore. My knee still is bugging me. But it's easy to take 1 day off, but 1 day turns into 2 real easy, and 2 turns into a week turns into a month. So sometimes you got to push through it. But this is, for the pro fighters, the UFC fighters, this is their life. They have to be there. So you do it. You tell them 72 hours. You do a procedure on a Wednesday, and then I go into the gym and I see some of the pro training, and there's the guy working the bags Friday morning.
I just saw you last night.
He's like, 72 hours, Wednesday, Thursday, Friday. I was like, no, you just did it Wednesday. So Wednesday to Thursday is 1 full day. Thursday to Friday 2. In theory, Saturday afternoon. But those guys, I mean, that's how they make their money.
I get it. But you saw what happened to Boss Rutten, right, with his arm? Did you ever see that?
Not sure.
So Boss Rutten had an impingement in his nerves, in his neck, and he ended up losing his arm. Like his arm just ended up, he would call it his baby arm. And I saw him a couple years after it started, and literally, I mean, you're talking one of the baddest guys on the planet that fought, and then his arm was like skinnier than mine. I got no muscle.
No, yeah.
So he had to do a bunch of like surgeries and stuff like that for it. And the one thing that came out afterwards is like, he said, I wish I would have taken more days off to recover.
Right.
And he tells people is that if it takes 2 months, take the 2 months to recover, because you're going to pay for it. And he has to walk up backwards. Like that's he would tell stories like if he go park the house after day, he would have to walk up backwards because he couldn't lift his legs up because his knees hurt so bad. He had like no more cartilage in his knees. It's literally like bone on bone. So like it blows my mind. So that's my question to you guys, coming from, you know, where you're at in jiu-jitsu and you see stuff like this, like how does this help someone, whether even at your level or someone at my level that's competing? Like how can this stuff actually help you with the recovery of it?
Well, it's pretty simple in terms of the PRP. What it'll do is, and it's not really even, you know.
You good, you.
All right. In terms of the recovery, the function, I mean, you know, you see guys get injured all the time. I mean, just, you know, their knee, you know, something pops, could be ankles, just whatever it may be, you know. I mean, toe holds. The PRP, I mean, we've all been there in some of these jiu-jitsu injuries that take longer than others to recover.
Yeah.
I mean, I remember I had a groin pull that, you know, a few years ago, unfortunately before I met the doctor, because now I almost feel like I have a get out of jail free card.
Yeah.
You know, like, thank God, knock on wood, I haven't had an injury, but I'm like almost like dying to try it out because I know that I got the ace up my sleeve. But I had a groin pull, and it was like 4 months before that. It was just such a slow process. You know, same thing. Ribs, you have a rib injury, that's going to take a long time to heal. I mean, shoulders, I know guys that had labral tears. I mean, it took, you know, months, and it resulted in surgery. But some of these guys that are coming in, they're like, you know, you understand, like, I feel unbelievable. We're getting these guys to be able to compete, to keep training. As I got older, I've, you know, learned I have to, you know, kind of chill out a little bit. You know, I mean, I have to know how to train and how to train with, you know, the different guys. So if I know there's someone who's real super aggressive, I got to be prepared for that. I don't want to get myself into a situation where I get injured, you know, trying to, you know, beat him at his game. I'm going to have to, you know, be a little bit smarter, a little savvier. And you see that with some of the, you know, the higher level guys that have been around for a little while. They're just a little bit more laid back, a little more controlled, a little more methodical. Their approach is a little more technical because, you know, you have to survive at the end of the day. I know I have to go back, you know, tomorrow to do the same thing. And I mean, I was telling someone just the other day, roll with Andy. Just when I roll with him, it's a different story completely because, you know, we're not trying to kill each other. You know, we're going like, you know, grips, position. I don't want to lose position, but I don't want to get myself injured. You know, that much is true. So I like rolling with the older technical guys now because it's just, you know, it's more cerebral than it is physical. But when I was younger, I mean, you know, that's it. You know, you're just going for it. I think that's why when I was also younger, I preferred no gi because it was fun, it was fast, it was dynamic. Now I'm like no, I want to just keep the pajamas on.
That's where it goes back to like technique and stuff. It's like, I don't have to go all out, right? But what about you? Like, what's your experience like dealing with this stuff though?
Well, for me, it's mostly been the testosterone therapy.
Right.
I'm 42 now, and I've been on it for the past couple of years. And I know before I was on it, I felt my age. You know, I didn't have energy to train every single day, didn't sleep very good at night, and hard time like staying in shape. You know, seemed like everything I would eat, I would just go right to my stomach. Yeah. But the past few years of being on testosterone, and we don't take it to have these superhuman levels where I'm going to win a bodybuilding show. It's just to keep me where I was in my prime. So I get those benefits, you know. Yeah. So like now I sleep better. I have more energy all day. I can hang with these like 20-year-old guys that are more aggressive and more energy. I'm right there with them usually. Yeah. You know, just overall feel better, you know.
Yeah. Yeah, you're doing replacement doses, which are a third of performance enhancement doses. I mean, the normal testosterone dose that's replacement, it does not performance enhance. It's 600 milligrams, you know, a week of testosterone and anthracyclinate, and the average patient is on 200. You know, so will their physique improve? Will their symptoms improve? Absolutely. But, you know, as far as performance enhancing, no. I mean,
Yeah.
You know, it's therapy that's optimizing your levels.
Yeah, I mean, it's really just keeping people at like the healthy level because, like you said,
the
the
heart
science
disease
behind
studies,
it.
yeah, heart disease, diabetes, it's huge.
Yeah.
I mean, it really works.
I mean, nowadays people trying to like really find all kinds of random stuff to sit there and blame for, but at the end of the day, it's like, no, it's really your body like aging, and these are the things that can do, and you're not looking for some miracle drug off of like Dr. Oz or something like that.
Right.
You're just doing the little things that you need to do to stay at an optimal level. So like, here's my other thing, because again, you know, as far as jiu-jitsu, we see like the older guys, like where you end up like looking at their hands and like they got the care fingers. There's, you know, even me, like I have pretty strong grips, but I know it's like, man, I know I'm not going to be able to sit there and hold on to these guys. Or you look at old like judo practitioners.
Oh yeah.
Like they had the hand and joints and stuff like that are totally jacked. But you were saying that this stuff is good for people with arthritis as well.
Yes, sir.
So, I mean, you're telling me I could go and just get a shot of PRP on my hands and I'm like, all right, I'm good to go. Like I can feel like, look, I come from a musical background as well. I've been playing guitar since I was 15, and I see piano players that like they have to stop playing because like their hands, like, I mean, I've seen people where their hands are just curled up.
You know, in jiu-jitsu, you know, when you get into like a gi battle where it's all grip. In jiu-jitsu, you know, I've always said this, jiu-jitsu is about two things, hips and grips.
Yeah.
You know, that's it. And when you get into that grip battle with someone and you just latch onto their sleeves or you latch onto that lapel, and I mean, it's just like, you know, several minutes.
Yeah.
I mean, you feel it, you know, in your hands, especially the next day. And you can ice it, you can tape your fingers all you want, but there is, you know, damage being done in there.
I mean, like in my hand, I snapped this like as a white belt.
There you
and
go.
it took me a year to be able to use this hand again because I snapped this finger.
Yeah.
And as a guitar player, I was like, oh, guess what? I guess I can't play anymore.
And I mean, like I've learned how to roll and kind of protect my hands a little bit from that, because that daily grind of doing it, you know, and I mean, you get those mummy fingers, you know, you spend 15 minutes taping yourself before you go into battle. So you learn how to try and, you know, roll a little bit smarter so that you don't have that damage, but you get into one tournament where you don't have that option, or you get into a couple of good battles and all of a sudden you feel the effects of it again. PRP, you know, that's one of those things that will help you certainly improve the mobility, the fluidity of the joints, because like he was saying, it will repair all forms of tissue, not just one time. It's not a Band-Aid. This is actually the process of recovering your body.
Yeah.
And it's amazing. And like Andy was saying with the TRT, the one thing about health is, you know, Andy and I are both in our 40s, and you know, like, you know, we're in jiu-jitsu shape. We're jiu-jitsu guys. We're doing this several times a week, so we're, you know, in that type of physical state where, you know, you can kind of tell a jiu-jitsu body.
Yeah.
And I'll take a look at some other guys my age, other fathers I see, you know, because I've got, you know, kids that are my age, and you know, you can tell these are the guys, their hormone levels are low, so they'll go home and they don't have the energy to do something like jiu-jitsu, so they sit down a lot, and it creates that negative cycle where they just, you know, gain weight and they're just tired and they feel like crap, and it has a detrimental effect on their life. Now they can't do as much with their kids, but you know, you see, you know, jiu-jitsu, it's life-changing because it keeps you active. Now you have the energy, you have the ability to spend more time with your family, do more things outside, and you know, anyone that has kids knows, you know, they have one speed and it's usually go.
Yeah.
And you know, you got to keep up with it. So you know, some of the fathers that are on TRT, they're like, man, it's helped my life out so much, because now I'm able to go play with my kids outside, take them to the park, go to the beach, do this, that, the other thing, you know. And I mean, not to mention that, you know, their wives are happier for it because,
for sure,
you know, I mean,
dads are being at home. Yeah. And I tell you, we're seeing levels of, you know, hormone imbalance, thyroid, testosterone, menopause in women. I mean, we're seeing, you know, symptoms and blood test levels, you know, 2 decades earlier than we used to. We're seeing it in the 30s and the 40s and the 50s now. You know, you used to not see low T until the 60s, 70s, and so there's a lot of factors, and most of it's exposure, environmental exposure, stress, plastics, PBAs in plastics, and stuff in antibacterial soaps. I mean, there's a lot of exposure, and there's too many variables to tell you why. We just know how to help, but you know, that's, and we want you in the top quartile when it comes to your hormone levels, where you were at your prime in your 20s and 30s. So that's kind of what you shoot for. But you know, you were asking about PRP in the hands, and you know, and we had talked about cauliflower ears, and you know, I've searched literature looking for that, but there's other compounds. PRP certainly won't hurt you, it probably won't break down a lot of the bonds with some of that. Now, any arthritic finger, sure, or hand or whatnot, like I said, I would try PRP on anything before I have surgery or have to take pills the rest of my life or anything. I personally, I've had both shoulders injected twice. I've had my back injected twice. Now this has been over a few years, but I have an angle problem with my rotator cuff than when I used to work out. So I'll get partial tears, and man, I haven't had a shoulder problem in 2 years.
Wow.
My back, I just had intermittent. It was intermittent, not chronic, but over years and years, I'd used to wear a TENS unit to work with my scrubs and tennis shoes because I was stiff if I played golf or played basketball. I mean, I'd be out for a day or two, and I don't like pills. I don't like doctors. So, PRP changed my world, and it's made a huge difference. But there are some other, there's something called collagenases that we can use for cauliflower ear or contractures, Dupuytren's contracture and things like that actually will break down the bonds. So there are some different things we can do besides PRP that could help in some of those other areas. And I'd probably mix collagenase with PRP. I'll have to, research the literature there.
That's pretty crazy though. Like you were telling me about the using PRP for cauliflower ears.
Yeah. Well, again, collagenase would be that's going to be more effective again. And I have to look at the literature. I know for Dupuytren's, but you can carpal tunnel, plantar fasciitis. You can use it for PRP for any. Again, you could use it for almost anything. I think
so crazy
these days. But yeah, there are some other things you could do that we will use for cauliflower ear or. Some where there's more of a connective tissue or cartilage overgrowth. It's a little different than nerve all the other things you use PRP for.
That's so nuts. That's so crazy to me. Sign me up. I'm good. So just to wrap this up, because I know we got to get going. You got a lot of guys that are interested in something like this, but a lot of people are either they don't know what to do to take the first step or what it involves. Some people are worried, obviously, about like whether it's covered in insurance or not. I mean, I'm not covered in insurance, right? So for me, I would sit there and say, like, from everything that I've seen, obviously with a lot of people that we know, whatever, like, it sounds like just do it. Like, do what you need to do. But what is it that someone needs to do to figure out, like, to get this rolling for them?
That's a great question. And, tragically, PRP, they started looking at this stuff in the 70s, but you really didn't see a big application when they started identifying growth factors in the 1990s. And then in 2000 is when it really got introduced into the orthopedic world, a little more mainstream. And It's still, I think everybody should be doing it. I think the orthopods, it's so effective that we really should be offering it to the the folks, any general population, especially with problems with the opioid epidemic and all that and chronic pain. This is a wonderful thing that could help there. Insurance does not typically cover it, nor does Medicare. It's not because of lack of science. If you Google scholarly articles on PRP, like let's say if you have a shoulder problem or back problem, if you want the scientific literature, the best Google search is to put scholarly article followed by whatever you're looking. So there are literally thousands of articles about PRP, and a lot of them are European, which is great. They're a little bit ahead of us there. So if you want I tell people, do your homework, find a doc that does it. It's usually a sports medicine doctor, could be an internist like me or internal medicine doc, but find somebody that does it, that you feel comfortable with, that explains the procedure, and talk to them about it, find out their cost or their price. But unfortunately, yes, insurance doesn't usually pay for it, but I tell you what, it's affordable. I think it's priceless. Like I said, I get a little discount, a professional courtesy from. I can't inject myself.
That'd be an awkward room to walk into.
Right, I would, because it'd save me a lot of damn money. But no, but I get a professional courtesy. But I tell you what, it's changed my world as far as just nagging injuries and ailments from sports all my life, that I think it's priceless, and it's affordable, and everybody can afford it. You put a couple bucks aside and you can do it, and you're going to improve.
Yeah, it's not and when you consider the cost of surgery,
my gosh.
PRP is not expensive.
A fraction.
Yeah, no,
it's fractions, right?
And in a lot of cases it works better because you have a surgery and you're still out 6 to 8 months.
And then you got to go back.
Yeah, and then you have the rehab, the therapy. So I mean, it stacks up money upon money. But PRP is actually really affordable. It works really well. So anyone that was, ever considering it needs to just pick up the phone, give us a call, because we'll set you we'll kind of just be completely honest with you, let you know our thoughts, come in, talk to this guy, and if it's something that may benefit you, we'll let you know. And it's funny because I really think a lot of times I talk to people about jiu-jitsu and what's preventing certain people, like, I got this bad shoulder, my knees. I was just talking to one of our patients today. He's like, when I was younger I used to do a little fighting with this guy. I can't do it anymore, my knees are really bad. And it's just like, well, PRP could help that out, and now you're going to be more active, and then that's going to help you lose the weight. One of the reasons that they came to see us. You're not going to have that sedentary lifestyle. So one small little injury to this guy's knee created the snowball effect, where now he started sitting down, not being active. Now he's gained weight. Now he's depressed.
Yeah.
It affects his hormone levels, because now
Absolutely.
obesity does that, chronic inflammation.
Yep.
So now he's not only is he physically in worse shape and in poor health, now emotionally, psychologically,
it's a downward spiral. Yeah.
It is horrible. Whereas one simple thing like getting yourself taken care of, a little PRP, maybe a little weight loss program, a little testosterone replacement therapy, it would change this guy's outlook on life. And he said something that was really sad. He's like, I just don't have the motivation. I just don't enjoy life anymore. And I'm like, my God, that's awful. So if we can I guess change that and help someone out, then at the end of the day can go home feeling really good about ourselves.
Yep.
No, that's awesome. The science behind everything and all this stuff just really blows my mind, and I definitely, I'm sure you'll see me in here. Pretty sure I'll have to come in here and get myself set up. And I'm thinking like my dad played rugby all throughout, like like when he was a kid, and I know he's feeling a lot of stuff.
Beaten. Yeah.
He's 60 years old, man, and I work pretty hard, but he works me into the ground, that's for sure. Gentlemen, I just want to say thank you very much for doing this. I got goosebumps just because, it's so amazing.
No, appreciate your time.
Thank you guys for taking the time. If anybody wants to get in contact with you guys to try and set up an appointment, what's the best way to do it?
Well, you can give us a call at 561-277-8260. You can also check us out, our Facebook page, Novagenix Jupiter. You can find us online at novagenix.org. That's novagenix.org. We're real accessible. You can we got Twitter, Instagram, all social media, you name it, just not LinkedIn yet.
Yeah, we gotta get you guys on LinkedIn, and you can always go get a roll with you guys. Go get some shots. Roll before you get the shots, and come in here and get the shots.
There you go. Both, so.
Gentlemen, thank you very much for taking the time.
Thank you.
Thank you for having us.
Hopefully this gets more people aware at the science behind all this, and really just it's one of those things. The preventative measures is better than any kind of surgery you're gonna have to deal with.
100%.
So thank you very much for your time, guys. Everybody listening in, please go ahead and give Novagenix a follow. Check them out. Even if you can't book an appointment to come in, not that I'm trying to sell anything, but you guys do what you need to do to really better your livelihoods. Not even as a jiu-jitsu athlete, but just everyday living as well.
Yep.
So thank you, guys. Thank you again.
Thank you.
Awesome.
Catch you guys next time.
All right.
Good night.
Well, there you have it, folks. I hope you got as much information out of this podcast as I did. It was insanely informative for me. And if it hadn't been for the time restrictions of everybody's schedule, I could have sat there for at least another hour or two just asking questions and really picking their brains on just everything that involves recovery as an athlete, whether it is through PRP or TRT or anything else that might be coming up. I know the doctor and I spent a little bit even before the podcast started, talking about stuff like stem cell, and it's just amazing to me the things that are out there that aren't just easily just brought up and talked about in public, and it's something that more people should know about. I am definitely going to be looking further into it for myself just because of all my injuries from years of playing sports and jiu-jitsu and Muay Thai and everything else. If you want more information, be sure to check out Novagenix.org. Just like Tim said at the end, if you guys have any questions, contact them. Whether or not you're going to be going to their office, I'm sure they're going to be more than willing to help you get the information that you need to really better yourself and have a more fulfilling life and not having to deal with pain. A big issue in Florida is pain clinics and doctors that are just willing to give out painkillers, and it's incredibly sad to see how many people get addicted to these things when you could easily just have a shot of something that your own body makes and heal up any injuries and not be in pain and move on with your life and get back to having fun and get back to training. Again, thank you so much to Dr. Sigman, to Tim Bruce, and to Andy Stock for taking the time to sit with me and answer my questions. I try to be as educated as possible on a subject before I come in and talk to everybody. And I can't always say I'm going to be, the most intellectual person in the room, but that's why I do this, because I want to keep learning. And if you guys can get anything from me asking questions, because maybe you're afraid to ask a question and sound stupid, I'm more than happy to sound stupid for other people just as much as I'm stupid for myself. But once again, thank you to Novagenix. Be sure to check them out. Show some support. If you have any questions, contact them. Please support our sponsor, Choke Aloha. Go to chokealoha.com. Use the promo code Jiu-Jitsu Radio. Get 10% off your entire order. Please support my art and my photography. The more you guys support the stuff that I create, whether it's photos or videos or anything like that, the more time I get to have into making podcasts like this that hopefully really help everybody one way or another. I just want to spread the positivity and do something good for other people and not just me. With that being said, please take the time to share, subscribe, and I have the podcast now on Stitcher as well as iTunes and SoundCloud, so it's available to you in many different ways. It's also up on YouTube if you want to listen to it on YouTube, but please help share the podcast so it can grow and I can keep on doing this, because I have a blast doing it and I want to keep doing it for you all. Thank you all for tuning in. I'll catch you next time.